In this module, we will learn about stroke prevention. Patients with AF, in addition to rate and rhythm control medications, receive blood thinners to prevent stroke. This is called stroke prevention for AF, or SPAF for short. AF increases your risk of stroke by 5 times. In other words, you are 5 times more likely to get a stroke than someone who does not have AF. Remember, you are at increased risk of stroke even if you can't feel your AF or even if you have no symptoms. Medications used to prevent stroke in AF are sometimes called blood thinners because they reduce the ability of the blood to clot. Remember that strokes happen when a blood clot forms in the heart, travels up to the brain, and blocks the blood flow to part of the brain. Lowering the ability of the blood to clot lowers the chance of getting a stroke. There are 2 types of drugs that prevent stroke: anticoagulants and antiplatelets. Anticoagulants affect a number of steps in the body's clotting system to reduce the ability of the blood to clot. There are 2 types of anticoagulants: warfarin, that has been around for years, and newer ones called direct oral anticoagulants, or DOACs for short. DOACs include apixaban, rivaroxaban, edoxaban, and dabigatran. Antiplatelets include aspirin and clopidogrel. Platelets are little cells that stick together to form a clot. Antiplatelets stop them from sticking together to prevent blood from clotting. These medications do not tend to be very helpful in patients with AF. You may still get a stroke even if you are on a blood thinner, but the chance of a stroke happening is greatly reduced if you take a blood thinner versus if you don't. In Part 4, you can learn more about how much blood thinners affect your stroke risk. Like any other medications, blood thinners have side effects. The most important side effect of blood thinner is bleeding because they reduce the ability of your blood to clot. So for example, in case of an injury such as a car accident, fall, or a finger cut, your blood will take longer than usual to clot, so you may bleed more or for a longer time. 2 forms of bleeding may occur as a side effect of blood thinners: minor bleeding, such as a nosebleed, which is more common, or major bleeding, which is any bleeding that requires medical intervention and/or a trip to the doctor or emergency. A major bleed could be bleeding into your brain, from your stomach or intestine, into your eyes, or any other part of your body. While on blood thinners, you should avoid taking anti-inflammatory painkillers. Some examples are ibuprofen, that comes in different brand names such as Advil or Motrin, and naproxen, with the brand name Aleve. These anti-inflammatory painkillers will further increase your risk of bleeding. Tylenol is a painkiller that is safe. Make sure you always talk to your pharmacist and ask them about drug interactions with blood thinners every time you want to buy a new over-the-counter medication. Many natural medicines can also affect your blood's ability to clot. Some examples are bromelains, ginkgo biloba, dancine, ginseng, coenzyme Q10, St. John's wort, and cranberry products. Do not take these natural products along with your blood thinners, and do not take these natural products as a replacement for your blood thinners. Always talk to your care provider or pharmacist about interactions between your medications and natural products. The decision about which blood thinner is best for you needs to be made in discussion with your care providers. Each of the blood thinner options have their own advantages and disadvantages. There are a number of factors that can affect your preference for one blood thinner over another. It is important that you know the trade-offs that need to be made and communicate what is important to you to your doctor when deciding on a blood thinner. The main differences between blood thinner options are effectiveness. Does it work? Bleeding risk. Will I bleed often? How serious would it be? Drug interactions. Can I still take my other medications? Dosage. How often should I take it? Dietary restrictions. Can I still eat my favorite food? Periodic blood tests. Am I willing to go for blood tests? How often are these tests? Antidote availability. What if I bleed? Is there a reversal agent to stop it? Cost. Can I afford it? Because of all of these factors, choosing the right blood thinner for you can be tricky. No matter what blood thinner you are on, you should remember: